Medications can lose their effectiveness or become unsafe when exposed to environmental factors such as moisture, oxygen, or light. Understanding how degradation occurs is important because improper storage or handling can lead to treatment failure, toxicity, or delayed recovery in patients. Hydrolysis is the chemical breakdown of a drug due to exposure to water. This may occur from direct contact with liquid water, humidity in the air, condensation in storage areas, or even during the preparation of a medication, for example, reconstituting powders. Water molecules react with the drug's chemical structure, splitting bonds and producing inactive or less effective compounds. In some cases, hydrolysis can also produce substances that irritate tissues or cause adverse effects. Many medications are deliberately manufactured in dry forms, tablets, capsules, powders for injection, to prevent this process from occurring before use. Water-sensitive medications are often packaged to minimize moisture exposure, such as foil-wrapped tablets, desiccant containers, powdered drugs requiring reconstitution immediately before administration. Some key points. High humidity areas such as kennels, treatment rooms, or tropical climates increase risk. Reconstituted medications usually have a limited shelf life and must be labeled with the date and time of preparation. Refrigeration may slow hydrolysis but does not stop it. Amoxicillin is an example of a medication susceptible to hydrolysis. Oxidation occurs when a drug reacts with oxygen in the air. This reaction alters the drug's chemical structure, which can reduce potency or create harmful byproducts. Exposure can occur during manufacturing, when packaging is opened through repeated entry into multi-dose vials, and if air leaks into containers. To minimize oxidation, oxygen-sensitive drugs may be packaged in airtight containers, single-dose ampules, containers filled with inert gases, e.g. nitrogen, dark glass to limit combined light and oxygen exposure. Once opened, these medications may degrade rapidly. For this reason, many have strict recommendations about how long they remain safe to use after opening. Some key points. Multi-dose vials repeatedly accessed with needles allow oxygen entry. Leaving vials uncapped accelerates degradation. Expired or oxidized drugs may be ineffective in emergencies. Morphine is an example of a medication susceptible to oxidation. Photolysis or photodegeneration occurs when exposure to light, particularly ultraviolet UV light, causes chemical changes in a drug. Light energy can break or rearrange molecular bonds, producing inactive or potentially harmful compounds. Sources of light exposure include sunlight through windows, fluorescent lighting, surgical theater lights, and examination lamps. Light-sensitive medications are usually packaged in amber or opaque containers, foil blister packs, or protective outer packaging. Even brief exposure during preparation can initiate degradation. Some key points. Drawing light-sensitive drugs into clear syringes too early exposes them to light. Leaving medications on benchtops under bright lighting reduces effectiveness. Mobile veterinary settings, e.g. farm calls, increase risk of sunlight exposure. Furosemide and diazepam are examples of medications that are susceptible to photolysis. When medications degrade, their chemical structure changes. This can reduce effectiveness, alter how the drug behaves in the body, or produce harmful byproducts. In veterinary practice, this can have significant consequences for animal health, client trust, and treatment outcomes. If a medication has degraded, the active ingredient may no longer be present in the correct amount needed to produce the intended therapeutic effect. As a result, the condition being treated may not improve. For example, if an antibiotic suspension has expired after reconstitution or has been stored incorrectly, the animal may receive only a partial dose. This can lead to persistent infection despite apparent treatment. Veterinary nurses should always check expiry dates, storage conditions, and preparation times to ensure medications administered are still effective. When treatment is ineffective due to degraded medication, the animal's recovery may be delayed. Ongoing illness can lead to increased discomfort or pain, reduced appetite and weight loss, delayed wound healing, and disease progression. In hospitalized patients, prolonged illness may increase the length of stay and the need for additional nursing care. In production animals, delayed recovery can also affect productivity and welfare outcomes. Treatment failure or prolonged illness often means additional veterinary visits, diagnostic tests, medications, or hospitalization. This can place financial strain on owners and may reduce their ability or willingness to continue treatment. For example, if an ineffective course of antibiotics must be repeated with a new prescription, the owner pays twice for treatment that should have worked initially. Clear client education about correct storage, e.g., refrigeration of liquid antibiotics, protecting medications from light, helps prevent unnecessary costs. Subtherapeutic dosing, when bacteria are exposed to antibiotic levels that are too low to kill them, is a major contributor to antimicrobial resistance. Degraded antibiotics may deliver insufficient active drug, allowing bacteria to survive and adapt. Resistant infections are more difficult to treat and may require stronger, more expensive, or last-line medications. Responsible medication handling by veterinary staff and owners is therefore an important part of antimicrobial stewardship in Australia and globally. Degraded medications may not only be ineffective, but can sometimes become harmful. Chemical breakdown products may cause tissue irritation at injection sites, toxic reactions, unexpected side effects, and altered drug absorption or metabolism. In critical care or emergency situations, using a compromised drug could place the patient at serious risk. For example, degraded sedatives may produce unpredictable levels of sedation, which can be dangerous during procedures. Veterinary nurses must be vigilant in identifying signs of degradation, such as discoloration, cloudiness or precipitation, cracked tablets, changes in smell, and damaged packaging. Any medication showing these signs should not be used and should be reported according to clinic protocols.